For months, many of you have asked the same question. Where are the arrests? Where is the accountability? This week, the Department of Justice announced what it describes as the largest healthcare fraud takedown in U.S. history. Before we break down the investigation, let's begin where the announcement itself began.
On these cases, I want to give some context around that. There are 9 healthcare fraud strike forces that have been part of this effort.
Good evening, I'm Marcus Webb, and this is Fraud Watch. Here's how Operation Gold Rush came together, and why federal officials say it matters. Just moments ago, senior officials from the Department of Justice, the FBI, the Department of Health and Human Services, and the Centers for Medicare and Medicaid Services stepped before reporters to announce the results of this 2-week operation.
Those folks standing behind me and next to me, we are more united than ever before.
The numbers were unprecedented. 455 defendants charged, 90 of them doctors and licensed medical professionals. The alleged fraud, over $6.5 billion in false claims. Cases filed in 56 federal districts, 45 states and territories, 50 state Medicaid fraud control units, the most ever activated in a single enforcement action in department history. Acting Attorney General Todd Blanche described it as the greatest whole-of-government effort to combat healthcare fraud in the nation's history.
To put 50 Medicaid fraud control units in context, every one of those is a separate state-level enforcement agency. All 50 moved on the same day. That doesn't happen by accident. That's coordinated enforcement at a scale this program has not seen before.
While criminal charges were filed in court, the Centers for Medicare and Medicaid Services moved simultaneously. CMS suspended 1,079 providers and revoked billing privileges for 1,403 more. To show you the scale of that administrative action, here is the CMS enforcement summary released alongside today's announcement. HHS-OIG filed 25 civil monetary penalty actions seeking more than $10 billion in payments to the Medicare Trust Fund, money CMS flagged and froze before it ever left the building.
That's the shift in how this administration is approaching fraud enforcement. It's not only prosecution after the fact, it's interception before the payment clears. CMS Administrator Dr. Mehmet Oz said the agency is deploying advanced data analytics to freeze suspicious payments and shut down bad actors before they can damage the programs that millions of Americans depend on.
This takedown did not stop at the U.S. border. International cooperation produced arrests on 3 continents. One defendant was apprehended in Kyrenia, connected to an alleged $3.7 billion scheme. 2 defendants were taken in Estonia, tied to a previously charged $10.6 billion case. And in the Philippines, the FBI's most wanted list lost one name. A fugitive connected to a previously charged $1.2 billion telemedicine fraud scheme was apprehended and returned to the United States. Here's the FBI wanted posting for that fugitive, pulled directly from FBI records. That fugitive is now in U.S. custody.
The international reach of this takedown is significant. These were not defendants who stayed close to the jurisdiction. They moved assets abroad, built infrastructure offshore, and ran schemes across borders. The fact that all 3 were returned to the United States in the same 2-week operation is the story inside the story.
Let's go inside the cases. The headline numbers tell you the scale. The individual schemes tell you how the fraud worked and who it hurt. The largest thread in this takedown involves wound care, specifically amniotic wound allografts, skin-like tissue products billed to Medicare as medical treatment. 11 defendants were charged across 6 federal districts. DOJ described this as a kickback machine. Here is the indictment language from the District of Arizona case so you can see exactly how federal prosecutors characterize the scheme. According to DOJ, from late 2021 through mid-2024, providers billed Medicare over $4 billion for this company's allografts, resulting in over $2 billion in actual payments. The company did not manufacture the allografts. It acquired them from tissue banks, relabeled them, and sold them at a 2,000% markup, charging up to $1,450 per square centimeter. The vice president of sales faces charges for allegedly running a nationwide kickback scheme. He is alleged to have paid kickbacks of roughly 40% of the sale price, allowing marketers and medical providers to pocket an estimated $500 to $600 per square centimeter. That defendant received over $24 million. He allegedly spent it on multi-million-dollar homes, a $135,000 Maserati, luxury watches, and million-dollar life insurance policies.
And the patients in this scheme? Per DOJ allegations, hospice patients. allografts applied without coordination with treating physicians, applied to wounds that did not require that treatment, applied to areas that exceeded the size of the wound. The kickback drove the application, not the diagnosis.
The Healthcare Fraud Unit's data analytics team detected a spike in allograft billing. Here is what that spike looked like by year in Medicare payments. Medicare paid $200 million for allografts in 2019. By 2025, that number had reached $14.4 billion. In 2026, after CMS cut the reimbursement rate, it collapsed to $100 million. The data caught the fraud. The policy change stopped the bleeding.
$1 million per patient, on average. For context, a legitimate Medicare claim for complex wound care runs in the hundreds of dollars, not the hundreds of thousands. The Healthcare Fraud Unit's data analytics team detected the billing spike. CMS responded by permanently cutting Medicare's reimbursement rate for allografts to $127 per square centimeter, effective January 1st, 2026. If CMS had not acted, allograft payments alone would have added $11 per month to every Medicare beneficiary's Part B premium.
In the Southern District of Texas, a nurse practitioner faces charges for a $906 million scheme. DOJ alleges she applied medically unnecessary allografts and billed Medicare more than $1 million per patient on average. The government has released photographs of assets seized in connection with this case. Here is what federal agents recovered. Agents seized more than $30 million in bank accounts, a $594,000 Ferrari, 7 additional high-end vehicles, an $865,000 custom Bulgari necklace, and $1 million in additional luxury jewelry. The defendant also allegedly used fraud proceeds to fund construction of a $4.6 million beach resort in the Philippines.
This is the pattern DOJ is naming directly. It was not doctors making medical decisions. It was a sales operation wearing a medical license. The allograft schemes alone account for billions in alleged false claims, and they represent just one thread inside a takedown that spanned 56 federal districts. Time for the docket. This is FraudWatch's running federal enforcement record, updated episode by episode. Chapter 1 is already on the record. The 2025 National Healthcare Fraud Takedown. 324 defendants charged. $14.6 billion in alleged false claims. That was the baseline. Chapter 2 opens today. The 2026 National Healthcare Fraud Takedown. 455 defendants. $6.5 billion in alleged fraud. International arrests in Cyprus, Estonia, and the Philippines. 50 Medicaid fraud control units, the most ever activated in a single enforcement action. This year's takedown surpassed last year's national action by 131 defendants. The defendant count has increased. The number of participating Medicaid fraud control units has increased. The geographic reach has increased.
In the Middle District of Florida, 3 defendants charged in a $118 million allograft scheme. A nurse practitioner allegedly used the proceeds to fund a luxury box at an NFL stadium and over $400,000 in fine art. And the escalation is structural. The DOJ's Healthcare Strike Force program has operated since March 2007. In that time, it has charged more than 6,200 defendants for alleged billings exceeding $45 billion in total. This year's operation involved 455 defendants. Last year's national takedown charged 324. The defendant count increased by 131 in a single year. 455 charged, 90 medical professionals, 56 federal districts, arrests in 3 countries, 1,079 providers suspended by CMS in a single day. The Department of Justice called this the greatest whole-of-government fraud enforcement action in U.S. history. But FraudWatch is tracking one open question. The Arizona allograft case, the $4 billion kickback network, ran across multiple states for nearly 3 years. DOJ charged 11 defendants, but the alleged payment total of $2 billion moved through a network of marketers and providers that 11 names does not close. Who else gets charged, when, and how many of the 1,403 providers whose billing privileges were revoked by CMS are now facing criminal referrals? The docket stays open. Stay sharp.